recording. Okay, once more on a Kabo. These are the Wẹll Bodi Betteh Gentri program. And my own name is John Fuller, and I'm a host. And today we deal with breast cancer awareness. And today is Sunday, the 12th of December 2021. Wow, almost Christmas Day, and I finished. So Aziza, Sesay, I go let family give as to what they do with IB and stuff like that. So I don't need to go through that. And like I say, the team with the Wẹll Bodi Betteh Gentri team, these are people that we don't study. But they are doctors, then they practice in various areas of medicine. We also get nutritionists, we get pharmacists, we get GPs, we get bone specialists, we get various people, we get social workers, we get health, and what they call the mental health people. So we get, I was saying a rounded team, and the team not just UK based. We get people from Hungary, we get people from US, we get people from Salon, we get people from Germany, and we get people right across the UK. And if anybody else feels say yes, thank you, but add value, we're happy for listening to them. But one thing will be big at the moment we really plead for that, then we get the influence for the able and make this show reach with people in the salon, whether by radio or by TV. We not go charge anybody, we will give them for free. We already have the program, nobody know they get paid, not free we do it for, we only do it because we want to try for help with people then in the salon. Okay. The advice of the general my generalized advice, not to say we pick on anybody. So if the story will tell is similar to you, not just by coincidence, but we not to talk about any particular individual. Okay. And if you get any problem, dear, continue for see you GP or your physician. Yeah, so we only give generalized advice, basically tell them for look out for, or if you go through certain things within you for the kind of question the way for ask and make your situation a little bit more understanding. I make you do in KRIO. So dear, if you they in doubt of anything, please see your GP. Okay. Okay. Now, like I said before, when a group of Sierra Leoneans, then we get to people in at heart, now we come together for bringing this program to now. Like I said before, we know they get paid. We only do it because we love the people there. Okay, and we do have in KRIO. As soon as we even get KRIO, white people who don't join me in the past, and now, for example, answer me talk KRIO fluently, but I will make it talk to a KRIO later. Okay. All right. Like I said before, also, if I get any suggestion or feedback, or I want to get in touch with we, the WhatsApp number this, and also if I want to go back for look at the videos that we don't make before. If you go on YouTube, it's GM Health, Wẹll Bodi Betteh Gentri, you will see the rest of the videos that will get up there. The last two sessions, I will not put them up with, but I will try to get them done and see at we can close for Christmas. And I will give me a little bit of more time for like able and catch up with the thing they wanted to do. Okay. At the end, we go ask Sierra while they present, we will take any questions until the end. At the end, now we'll take questions. And there are two ways. If you are not physically, if I see you, I will come to you and ask, if I'm not come to you quick, let not feel like not see, I not see you. If I see you, I will make sure I come to you for take a question. And that first comes first served. The big mistake, I'm mortal man. If I make mistake, I apologize in advance. Okay, but the way you can do them from the app, you can look now so you will see them three dots there. Now, if you press that three dots there, this thing at the middle will appear. And if you look at that thing there, you will see chat. The shame, or maybe also the environment not good for the ask questions. So send me a text, just like how you would text on WhatsApp or Facebook. Just send me a text of which you want. I'm spelling a KRIO English. It no matter. Just send them no more. I will read them out for letting the presenter understand. And also, if you want issue hand, if you look at this bottom now, so you see raise hand. So if you look on the third one, I have circle so you can press that for raise your hand. So now, if I'm I don't talk beaucoup. I can pass on now to the Bukuman. Dr. Aziza Sesay, when you're ready, take me away. Thank you very much.
Hello, everyone, and Akuche, Nakabo, Bodi. I got to see all man today on a Sunday night. All man look well. Okay, I just go share my screen. You all they see this fine? You able to see, huh?
Yeah.
Amazing. Thank you so much. Okay, so I'm gonna start. Okay, Howdy, Bodi. Thank you so much, Mr. TJ Fuller, the magic man, for introducing me. I go introduce myself again. Mina Dr. Aziza Sesay, Mina GP na England. And yes, I'm glad you could be part of this team where we're just here to help with people then, like TJ say. Today, now very, very important topic. And it close to me at because this is a thing where I feel say all man get for member, and this not just for woman them, okay? I hope so we get some man them where join me today because this sick breast cancer it affect both man and woman them, okay? So I want to make all man listen. Please pay attention. I go apologize first for say, please don't let me KRIO. I go tower small, but I did try because I want me people them with this alone for understand. It's very important. We get for talk about this thing them, okay? So let's start. TJ already tell we say this talk that general health education information advice. We not a give advice, personal advice to people them for specific things because it no go legal and it no go safe. So if you hear something where I tell you say today where you think something I guess this, please do I beg. Go see your doctor or go see your clinician, go see person, okay? That's the aim. We want to make you aware of the sick so you go catch them early and you go see your doctor. So today we go discuss what is that cancer self. You get to understand what in a cancer, to understand what in a breast cancer. And then I go talk about the risk factors of the breast cancer, what in the symptoms person they get with breast cancer. So the things and when they see in their body, where go tell you say something you get breast cancer. And I want to talk about the screening process. So the things where the doctor then can do for check for see whether or not you get breast cancer. And then other then they invite for that day. And then I want to explain what in the results of this screening test, what in they mean and what it happen next. And if they think to say you get breast cancer, they get for understand what in they go on. So what it happen after that one as well. Okay, before we start, I want to make all man, hopefully TJ go unmute all man. I want to ask 3 questions because I want to know Usai all man they at now before I don't tell you everything. And don't worry, all the question where they ask, all the answer go come. Okay, so this is not the question then. And I want to make everybody please just answer yes or no, okay? So, can men get breast cancer? Man them they get breast cancer, yes or no?
Yes.
Yes.
Yes. Yes. Okay. The second question, Black woman where they get breast cancer, then they present late with aggressive breast cancer? Then they yes? Or
Yeah.
no?
Yeah.
Yeah.
All man they think yes?
Yeah.
Okay. And then the very important question, when I all where they watch, please be honest. Now all they examine you will be
Me, yes. So
Yeah.
every month. You examine
yes, I do. Yeah.
At
Yeah.
times.
Sometimes, yeah, sometimes.
at times, but at least every month.
Most of
You
the
do it
time.
once a month.
Most of the time, yes.
Yeah.
Okay, I'm glad you for hearing Dande. Okay, Dande, fine. We're starting off on a good
When
foot.
I'm having a shower.
Say that again.
No, I said, especially sometimes when I'm having a shower.
Okay, good. I'm glad you for hearing Dande. Thank you so much. Okay, if we're not all can mute yourself, we can start now properly. All right. Okie dokie. So what's in a cancer? Cancer, now when the cells were there inside the body, we get plenty of cells inside the body. When they start to divide abnormal, they know they divide well, okay? Something don't happen with it, the cell don't pull. Because of that, it divide for make more of those pull cells. And when that happen, that cancer they form. Because we body get this system where the cells they divide in a way we're organized. But sometimes can they where the cell go pull and the body no see say the cell pull and then it just divide like Chris and then they cause the cancer. So why make this happen? Now, but good things that can cause the cancer. One, genetics. So sometimes can come where you get genes from your mama and your papa, where again, a faulty, a well, and then they increase the risk of you for get cancer. Sometimes can come where you get external factors like chemicals. So you know the tobacco where they're inside the smoke, and then they cause cancer. Or UV radiation, then they like thing like the sun. The sun, if we get boku sun in our body, it can cause cancer. Infections, different infections there where again it can cause cancer, things like hepatitis B, HIV, other infection like HPV, human papillomavirus. So some infections then there where they cause cancer. And as with the age, unfortunately, things inside the body, I mean, it's easy for the break. You feel yourself when you get old, all things they, slow down. So now that they make the cell them spoil again, where they increase the risk for cancer. But I want to emphasize this point. Cancer, in no care. You be president, you be minister, you be doctor, you be the richest person in the world, or you don't get money, in no care. It happen to anybody. So now that this is really important for all man for you read this, because it can happen to anybody. And the recent statistics, it is said that 1 in 2 of us will get cancer. 1 in 2 of us. And I don't want to make people them afraid, but now that this is very important for we all to listen, okay? All right. So if all man can look the screen, watch the screen, I want to make una all see something, okay? Or somebody no mute. If you can mute yourself, please, so all man go hear me fine. I'll be grateful. Or TJ, if you could mute everyone for me, please. Okay. Okay, so the picture where it is shown at the screen, na Bobby. So if you look the screen, look like say the Bobby na the side and then cut the Bobby so we can see inside the Bobby. So what thing I they emphasize now, you see them things then they look like trees, not so. You see the leaf them, you see the branches. Then now what will they call the breast tissue? The leaf them and the branches now the breast tissue. Now yeah, they make the milk for the Bobby water. And this, now they ducks them. They carry the Bobby water outside through to the nipple, okay? And in between, we get fat now with Bobby. So that make people then get different size Bobby. Why make I show you this? Now yeah, where the cancer they start. I want to make you understand that. And this breast tissue, where they explain, now that we can feel that hard thing now with Bobby, now that we can feel as hard, now the breast tissue, and now that also the cancer they happen. And I want to emphasize, you see this, yes, it's big in woman, but man them get breast tissue, but usually it's just a small amount here behind the nipple. Now that make man them can get breast cancer as well. So all man were asked, they were right. Okay, breast cancer, what's in a breast cancer? Now when you get poil cell them inside the Bobby, where they grow and divide like in an uncontrolled way, in the cell that don't crease, and then they form a growth where we they call a tumor. Breast cancer, now the most commonly occurring cancer where it happen to women, okay? But like I don't say, it happen to men, not as frequently. Only 1% of the Bobby cancer where it happen, now man then get them, 1%, and then they get them. It causes one of the greatest numbers of cancer-related deaths in the world in women. So all the women then will get cancer. Now breast cancer, they cause more of the deaths, so 15%. And around 55,000 people, they get diagnosed of breast cancer every year. 150 new cases, 150 people, then they get diagnosed with breast cancer every single day. Then in Aboku, not so 150. And the cases just they rise. Every year the cases they rise. And I just say again, I know they say all of this for make una all afraid. I just they say this for make you una all aware, say this Bobby cancer, it catch people them, and we get for understand the risks involved, and we get for get aware as to why this did happen. So with breast cancer in the UK, 1 in 7 women them go get breast cancer in their life. And in the world, they say 1 in 8 women go get breast cancer in life. It is the 4th most common cause of cancer death in the UK. But what's in good, the survival for breast cancer, so the people then where they survive the cancer, it improved. And in the last 40 years, the people where they survive, the cases don't double, which is a good thing. But now I want to emphasize this point. Your survival, it increase if they catch the cancer early. So the statistics where they find, they say people then when they catch the cancer early, 98% of them people then go live 5 years or more, compared to only 26% of people then when they catch the cancer late. So now that make it important for know what in a breast cancer, what in the symptoms for breast cancer, and what do you get for look for, so you go catch them early, so your survival go increase. But let me talk about the risk factors, the things then where they increase your risk for get breast cancer. I've been on say one thing, for be woman, unfortunately, it increased the risk. 99% of breast cancer, they happen to women. Again, I've been on tell you if you, when with the age, it increased the risk. So then they say 80% of all the breast cancer, where they happen, then they happen to women where on 50 or more, 50 years old or more. Also, if you get too much fat in your body, then they increase the risk. And then because when we fat, we increase the hormones. So we get this chemical within inside the body called estrogen and progesterone. We call them sex hormones. Now, these sex hormones, they feed the cancer. Now, then the cancer they eat. So when we bump, we produce more of them hormones. And in man them, if they get beaucoup fat na them belly, it increased their risk by 30%. Also, if you smoke, and do I beg, if you smoke, just left for smoke, there's no benefit for smoking at all. But smoking, it increased the risk. Alcohol, they increase the risk. And it increased the risk because it increase the production of that sex hormone where I've been on tell you about. The other thing now, genetics. So if you get family member where get breast cancer, then they increase your risk by 2 times. So if your mama been get breast cancer, or you picking them, or you sister them, then they increase your risk. But I want to emphasize here that just because you get person where get breast cancer, it don't mean say you go get breast cancer for sure. And just because you don't get person when don't get breast cancer, it don't mean say you don't go get breast cancer. The statistics, if you're interested to know, 85% of people then will get person with family member will get breast cancer, they're not gonna get breast cancer. But 87% of people when not get any family member will get breast cancer, now then they get breast cancer. So they explain this just for make you understand, say, it random. It don't mean say, oh, you go get them for sure if you family member get them, and it don't mean say if you no get family member, you no go get them. So now for be aware regardless of the case. The other thing where they increase the risk now, certain genes where they want inside the body. The genes, the common one where they cause cancer, the name now BRCA1, BRCA2, when you get a faulty gene, the Wεll gene, now then it increase the risk. Also ethnicity. Now, white women them, yes, then they get bobby cancer more than Black women, or much more than all men. However, now Black women, when they get breast cancer, then they get the worst kind, and then they die more. But I'll go talk about that one day more in a minute. Also, if you just sit on, the exercise, the run, then they increase your risk for breast cancer as well. And if you get big bobby, we get a lot of breast tissue. If it dense, then they increase the risk of breast cancer by 3 to 5 times. Also, other things where they increase the risk, if you've been your menses, your period early, if you've been young when you start, if you reach your menopause, you finish your period late, then they increase the risk. When you get your first pikin, you've been old small, then they increase the risk. If you don't get any pikin again, it increase the risk. If you never breastfeed, then they increase the risk. However, if you've been get operation where they pull your womb or you pull your ovaries, where they make the eggs, then they reduce the risk of the breast cancer, because now the ovaries where they make the sex hormones what I've been don't tell you about. So if they pull her, then they go reduce your risk. Also, medication where get the hormone them, then they go increase the risk as well. So you know the one where woman can take for make belly, or if woman don't reach menopause and then they take the HRT hormone replacement therapy, then them go increase the risk, because now the hormones again where you did put inside your body. But I want to emphasize not just small risk, 1% and 2%. And also they don't say that if you stop to take the medication after 10 years, your risk go back to normal. What's the risk for any woman when not been taken? So I want to emphasize this point, because obviously we Salon woman, we all not Black woman. So the risk is high in we. Black woman, when they get body cancer, the cancer more advanced, so it's more serious, it's more aggressive, it's hard for treat. And beaucoup of the Black women, then they present late. So when they come in, the cancer don't spread to different parts of the body, which they make the treatment at. Again, in Black women, it's common for occur in younger Black women. So I've been on tell you, say 80% of the breast cancer would it happen, then they happen to women we're old 50 years or more. But in Black women, now 70%. So 30% of all the breast body cancer would it happen to Black women. Now, them were age less than 50 years old. And it particularly common in women were 45 or younger. Also, the prognosis, so the survival, whether you go die or not, it's very, very poor. The survival is very poor. And the woman, Black women will get body cancer, they get the highest mortality rate. Now then they die past all men. 40% more deaths compared to the white woman them. So it's really serious and it's very scary. I did tell you this, and then me, I did afraid myself, but now that make we get for talk about that. And unfortunately, if Black women get body cancer and they treat them, it's more likely that it will come back. So why is this important? Or what to make this to happen? They don't understand. Some people then say, oh, something are the socioeconomic factors. So because the way the Black woman then they live, or what in they understand, what in they exposed to, what in they eat, that kind of thing them. Or sometimes they don't get the access for go get the checks, or they don't get the health awareness. And this is not the very important thing. Now that make I say I go do this talk. Beaucoup Black women them, and I see them myself, where nothing to say they go get breast cancer because they think say now white woman in disease no more. Black woman no they get them. And that's not true. And because they don't get the awareness, they don't know what in for check for. And by the time they don't get the diagnosis, it's on late. So sometimes then they add to the statistics where I don't tell you. Again, they think say sometimes genetics day. And the fact is, racism does exist, unfortunately. Some Black women, they say, well, when I want to go see my doctor say, oh, nothing, no, you know, no, not a problem, no worry. So then they go influence the rates. Also, some women, they say, oh, it go take before the doctor see me, the doctor diagnose me, the doctor treats me. And the care in which the Black woman they receive, again, it's usually substandard. It's usually not that great. Again, with Black women, and they do beaucoup thing, and they get beaucoup stress, And we know say stress, the influence and they increase the risk of beaucoup health problems, including cancer. And also, I don't tell you say that Black women, them, they get breast cancer around the age of 45, like it's more common in that age, the younger age them. But in certain countries, like the UK, they know they start the screening until the age of 50, but then they don't late at that point. So something for consider. And then the other things, now the chemical products where we put now we body or we hair. Like, you know how we've been the palm we have, we make it straight. And then say that the chemical with the inside, it cause cancer and it increased the risk of cancer by 18%. And then the people then where they bleach them body, again, the chemical with the inside the bleach, they increase the risk for cancer. So now then things that we get for consider. So what are the symptoms of breast cancer? If you all can look at the screen, because it's easier for me to explain with the picture. So what do you go look for? When you look, Yusuf, you want to look for see you bobby size, it don't change before one bobby been there, before the bobby been there the same size, and then you notice say one bobby don't big past the other one when you know been there so before, or you notice lump where they inside your bobby, or you notice a change in your skin. It don't look, it rough small, or it look like, you know, the peel of the orange. Or you notice the redness there or rash there, now you nipple, now you bobby. Or you notice, say, you nipple, when it been the point out, it don't turn inside itself. Some women, them, the nipple turn inside itself and that's normal. But if it not been there like that day before and now it don't turn, then I forget and check, then you for worry about. Also, if you notice, say, water they come out from your bobby, you get bobby water and you know get belly, you know the breastfeed. And especially if you notice, say, the water is green or red, then again, that's a sign of potentially breast cancer. If you notice, say, you get pain and you bobby and you know they go, they tear or they inside your armpit, again, now for check, just in case. Or if under your armpit, you see lump or you feel lump there, again, all them things the way I just saying now, the potential symptoms of breast cancer. I know they say that, oh, if you get her, you 100% you get breast cancer. Not to that day. But I just to emphasize, say, please, dear, if you notice any of them things, then see your doctor, get the check so they can exclude it. So I want to take some time to talk about the breast examination. I'm really glad for Yeri. All man will answer the question. They tell me, say, then they do often. So yes, I want to make all man they do the breast examination often, at least once a month. But if you can do them more often than that, great. Because the point I make is because if you know what's normal for you, if you understand your body, you understand your bobby, then you go, if something changed, you go notice I'm like this, you go notice I'm right away, you know, go afraid. Sorry, you go say, okay, you know what, let me go get it checked, okay? So it's so important that you know what's normal for you. And I know they just explained this for the woman them, this now also for the man them. Both the woman and man them, please check yourself once a month at least, so you understand your body, again, so you could pick the changes up quickly. So how you do the breast examination? Okay, so what you get for do, make sure you pull your top half and your bra completely, and you face the mirror. And again, like I just tell you what you for look for, you look at the mirror and you put your hand in 3 different positions and you look fine. You put your hand down like this, and then you put your hand on the side like this, and then you lift your arm up behind your head like this, because if you put your hand in them and then different position them, it will give you better look of all the area of the bobby. And make sure you look this side as well, okay, from side to side. And you did look for, again, you did look if the size don't change, if you notice any lump, if you see any redness, if you see any change in the nipple, if you see discharge, all them things, and at that you did look for. So spend some time and just look so you know what you look like. After you don't look, then you did move to feel. So I just explain one way, but beaucoup different way than you can look at YouTube as well. But as long as you're doing one of these things, then it should be fine. Make sure, say, either you, one auntie will say, or somebody will just say, then they check when in the shower. Perfect. We they shower every single day, so that's good. It means that you go check in the shower. And the reason some people then do that and now they shower is because, you know, the soap, it make the skin slippery, so it's easier to examine properly and it no go act. But usually if you get bigger Bobby, it's probably better if you do when you did lidon. Yeah, you did lidon, and what you get for do, you put one arm up above your head like this, and then with your other hand, now these 3 finger them you use, okay? And I want to make you cut your Bobby into 4. 1, 2, 3, 4. Okay, and you keep your hand up like this, and then you start from the nipple, and then you rub. You give a rub all sides. Concentrate, take your time, feel all side, and then make sure, say, you go up, Naya. You go into your shoulder blade. You go inside, yeah. You go inside your armpit. You feel, you push. You go inside your collarbone like this, and then you go Naya as well. Okay. Make sure, so you check all them area them, and after you done, make sure you check the other side. Because sometimes you go find something on one side and then it will make you afraid small, but maybe that ain't normal for you and you go notice that on the other side. But whatever the case, if you notice something and it make you afraid, do your beg see your doctor, at least to get checked out. Okay, what's in the screening test available? The checks, where for check whether or not you get breast cancer. The first one, I've been on tell you just now the breast examination where I show you. That means that you own way for screen yourself. And you do that then that you own, now you os, no wahala there. But that is the best and most important way to screen yourself in the first instance. But the other way for screen where they involve machine them, the mammogram, one of the ways now mammogram. This now, when they take x-ray of you, Bobby, the machine feel by this. So the Bobby, then they put the Bobby in between 2 plates them, where then they press onto the Bobby like this. They press down onto the Bobby like that, and they take one x-ray, and then it go turn the Bobby to the side, and again, the plate they press down, and then they take another x-ray of the Bobby. Some women, they say it's uncomfortable, but it just they last a few seconds. It not go last long. And again, why make it good? It go pick up if any changes there inside, it go pick them up early. So again, it go improve your chances of surviving. Other way for screen include MRI scan. Now, usually they do this to younger women them because when we're young, we get more dense tissue, more breast tissue, and the mammogram, you know, go see things and now well. So the MRI scan will give us better imaging. And this now what's in the machine fiber. So the woman they done like this woman, and then they go put you inside the machine, and again they go take the picture of you, them. So the point, like I say, now for find breast cancer early. You know, they stop breast cancer for happen, but it catch them early. So like I say, it go increase your chances for survive. So in the UK, they don't do the calculations. They say breast screening reduces the number of deaths of Bobby cancer by about 1,300 a year. It is saved 1,300 people in a year because then they catch the cancer early. And from the breast cancer screening program in this country, in the UK, now only 1% of the women them where they screen, where they diagnosed for get Bobby cancer. So please, no afraid for go and say, oh, they go find cancer. No, not only 1% of the people then when they screen will get the cancer in the end. So Udan and they invite in this country. Now they talk about the UK, but different country get different rules then. And in Salon, they get different organization where they help the woman them for do the screening as well. So it's not like a set screening program, whereas in the UK, they get the set screening program. And I just to tell the woman them where they inside the UK for understand how they work. So woman, we're age 50 to the age of 70, then they get invited every 3 years, as long as they don't register with the GP. Now, some areas in the UK, then they see for change the age small. So some areas, and then they call the woman from 47 to 73 years old. Because I don't tell you, say some woman, then they get breast cancer way before 50. So then they say, sometimes they get for make them younger. And women then way over 70 years old, if they're inside the area when they test after 70, they can go to the GP and say, please, can I get the screening test? And they go do it. So what's happened? I don't show you the picture, I just emphasize the point again. The mammogram, not only the mammogram I show you, you get 2 plates with an X-ray, and again, it push down the person onto the woman in Bobby. And then after you do one, you do the second one when you turn the Bobby like this, and then it press again, and you take the X-ray. And it did check for see if any changes inside the Bobby, it could be cancer. And it usually takes 2 weeks for the results, but things are a little bit slow now because of COVID. So what are the results you go get for breast cancer screening? Now, Boku Umanem, I don't tell you, say only 1%. So 99% of the Umanem where they screen, majority of the time, it's normal. But there is a chance that it could be abnormal, okay? So 4 out of 100, now 4% of the Umanem where they screen, will go get abnormal results. 4% abnormal result. But when they say abnormal, I don't mean say you get breast cancer, okay? That name means say they get to do more check. They get to do the mammogram, they get to do the ultrasound scan, they get to do biopsy, where then they take some of the tissue from the Bobby, or they get to do the ultrasound scan where like what they do to belly woman for see the Pekin, but then they'll do down there to the Bobby and the MRI scan. And what you then see, of all the women where they test abnormal, only 4 out of 5 didn't have breast cancer. So only 1 out of 5 of the women where test abnormal get breast cancer. Again, for reassure you, say, mean say because they're abnormal, you get breast cancer. And some women when they do the test and they're not clear, so then they call the woman for come back again for check. But if the tests come back normal, then you go back to what they call the routine screening. So then they go invite you again in 3 years' time. But again, for emphasize, Naya, if you've been get your screening, even if it was 2 weeks ago, 3 months ago, a year ago, if it been normal, but you examine yourself and you feel something there, please see your GP just in case, or your doctor, just so they can examine you again for make sure say what you did feel not to cancer, just in case, because screening not just check, it's not definitive 100%.
Sorry, family, I think I don't freeze. Dr. Kamar? We just want to maybe Dr. Kamar from the beginning take some of the questions. Aziza, sorry.
Hello.
Please.
I'm so sorry. I think I got cut off.
Are you turned sideways now?
Oh, my sideways?
Yeah.
Wait. With my Ben made.
Yeah.
I'm so sorry.
Go on, yeah. Right.
Now you like me up. Not so worry.
I think you have the slides. I'm so sorry, everyone.
You are sure?
Yeah, if you share the screen.
Okay. 1 minute. I'll just go and come up.
Sorry about that. My laptop, I know somebody waiting to it. It's gone camera shy.
You know they jealous, no them for you. Don't worry about that.
Yeah, they're gonna all
Might
that
have been-
something. Me
I'm going
laptop,
to
he
drag
say
them.
no. He say you
That's all
talk
right.
boku.
No worries.
I did talk boku on my own games. Even the laptop gets.
Anyway, yeah.
But
Don't worry about that.
I've been in talk about the screening.
Yeah,
Whose side you left? You left. Where were you guys at towards the end? Where did you leave me? Oh, actually, I might be able to do.
Yeah, the screening.
Yeah, hold on, pass. Yeah. Okay.
No matter, I can repeat yourself, TM.
It's okay. No, just show them. Then go tell me. So
Yeah, that's right. No worries. Yeah.
Wait, I go back on Zoom. See that one screen I use. So.
Am I still upside down?
There we go.
No, it's straight. It's straight. No worries.
Okay.
Yeah, you're upside down like slightly.
Right, there you go.
Like
That's it.
I'm joking.
Yeah, examination. Yeah.
Okay. So you want to go to 16? Yeah. Skip. Skip. We when I all see all this, right?
No.
Yes, yeah.
Yeah, that's it. Yeah, that will be there. That's right.
Keep going. And then keep going. Okay. I've been on talk about all of this. You all hearing me when I say normal, abnormal, unclear?
Yeah, that's right. Yeah.
Okay.
Yeah.
Okay, we don't move to the next part then. Okay. All right. Honestly, we're almost finished now. So people that will get family history of breast bobby cancer, now then they get increased risk of bobby cancer. I've been on tell you 2 times the risk. So then people then get for do the screening more often than the people that will not get family member will get breast cancer. And that's just in case. So woman way old more than 40, then they get mammogram every year. You see, the routine screening every 3 years, this one every year. And if the woman them under 14, then go get MRI scan every year between the ages of 30 to 40. Because of the reason I've been on tell you say before, when you young, you bobby, it dense, it thick, you get too much breast tissue, you're not going to be able to see any changes in the mammogram on the x-ray. Now that make them do the MRI scan. So woman them we get faulty gene, they inherit the faulty gene from their mama and papa. Then they screen even earlier. So I've been on tell you about the BRCA1, BRCA2 gene. Now then, if they get that mutation, they get MRI scan every year from the ages 20. It depends on which one they have, either 20 to 30, and they get checked every year. Next. So if you get breast cancer, what thing they happen next? If the doctor don't diagnose you, they get for then employ what would they call the multidisciplinary team, like Bodi, Betteh pass Gentri. You get beaucoup different types of clinician when they look together for decide what's the best treatment of care. Next. But what they get for do first, they get for understand whose type of breast cancer you get, and they get for stage the cancer. They get for understand what stage of cancer you dip on, whether the cancer just then on one side normal or you don't go to the other side of your body. And all them things there, they vary the treatment. But the treatment options are usually, next, you can get surgery, you can get radiotherapy, you can get chemotherapy, where they put the chemical to your body, you can get hormone therapy, or you can get targeted therapy. And all of this depend on whose type of cancer you get and whose stage of cancer. And sometimes can come when then they do the surgery and they add radiotherapy, or they do the surgery and they add chemotherapy. It all they mix, it depends on whose type of cancer you get and what thing the specialist thinks say best for you. So I did explain this because I don't want to make you think say, oh, I sabi that woman, he been get breast cancer, then pull all in Bobby, and he been get this and that and so on. It don't mean say you go get the same thing again, okay? All men different, and they did tailor the treatment based on you and on whose kind cancer you get, okay? And whose stage you be. So thank you so much. I'm really sorry for that disruption where it happened. Thank you so much, TJ and everyone for supporting me on this. My laptop against for my voice. I hope so you know against for my voice with you all they watch. But the most important thing to take home is, please, dear, understand your body. Understand what is normal for you. Do you check them? Because again, if you do this one regularly, you're gonna know if you get if something changed or something not right for your body, and you go see your doctor early, and hopefully the diagnosis will be early where the treatment will most likely be successful. Okay. Also, if you worry about anything where you don't find and you think say something not right, please trust yourself, trust your gut. Go see your doctor for get check. If you think say something don't change, just see your doctor. No left farm, please. Because then they go change the treatment. Then they go change your chances of surviving as well. Also, I know say people then can say, the doctor, the mon ami, he invite me for this all the time. I don't want to go. Please, dear, I beg, go. Because I don't tell you, say they catch the cancer early, and it is saved over 1,300 lives every year. Now this country alone, because it catch the cancer early. And again, the treatment not will be too severe. And the other thing I always say, please be healthy, live that healthy, balanced lifestyle, because they don't say that 30% of the cancer deaths, it can all be avoided if we all eat and live healthy, if we know they smoke, if we know they drink too much alcohol, if we exercise, we have fruits and vegetables, all the things that we maintain a healthy weight, it reduce the risk of cancer by 30% of the deaths. So do honor all, please. Let we all know we serve, and let we all take care of ourselves, and let we continue for join these kind to talk them to understand what we get for look for. Thank you. The next slide is just thank you. Thanks, everyone.
Dr. Aziza is thank you again, right? Okay, thank you very much, everybody who are on patient and on listening to the session very, very much. I believe we people appreciate all within you don't do today. Now at the time for question and answer, I will ask if you get any question, you either the app and you raise your hand up. Dr. Ture, you're welcome, sir. On me, Dr. Ture, Dr. Kamara. Okay, so anybody else, if you get any question for ask, look at the time for you ask. One part of the thing that you see, Dr. Aziza, why that's on the womb. You say woman then we don't pull the womb or not get egg or something like that, then chances for getting what shall I say, reduce? Is that correct?
Yes. So the evidence where they don't find, they say woman then we get a womb and ovaries when they pull them both, then they reduce the chance of the breast cancer. And like I said, now the ovaries where they produce the hormones where they increase the risk of breast cancer. So if we pull the ovaries, that helps to reduce the chances of breast cancer occurring. But I know they say all men get to pull them ovaries, them. No, I know they say that.
Exactly.
Celebrities where they, if you know, what's her name? Oh, God. Angelina Jolie. Angelina Jolie, in mama been get breast cancer and I think ovarian cancer, and in mama die young. So because even the Fred, he check for see whether he get the faulty gene, and he been get that faulty gene. So he decide for himself, because he get he decide for himself, he say, okay, the risk high. So I go pull me on. I go pull me bobby, I go pull me womb, I go pull me ovaries. Now in decide for himself. But I know they say all man get for do that. That then just they reduce the risk for themselves. But
okay.
Yeah.
I can ask another question. We link to Dr. Bell in session last week. I know I'll be asked the same question or something similar. But for the benefit of the one they will not be in there, I will ask a question in the back. When it comes to contraception for women, them, the coil and the pill and the stuff, I follow the call and Captain Ban. Will not ask me, I know we say for the year, we can go to I can say. Yeah, risk for women get breast cancer or any other cancer?
I missed the first.
The contraceptions, the way they can give women them, either the tablet or the stuff or whatever, any of them, we can expose women them for letting get cancer.
Yeah, so when I've been tell you this in the lecture, I explained, say, the evidence so far within a FANG, so the contraception, not only the oral contraception, the one where you take now you mouth, the one where you get estrogen and progesterone, the two of them together, now then where they increase the risk, but it just increased the risk by 1%. Now 1% no more, it increased the risk, so now small risk. But I get to emphasize, they say, if the woman stop for take for 10 years, then the risk will be the same like woman when not been taken. You understand? Okay. So not only 1% risk it increase, but I mean, it's a risk benefit thing. So the woman, they make the informed decision for instance, if you want to take the risk or if you don't want to take the risk, but again, a really small risk.
Okay.
And often, before they start you on those pills, the doctor go talk to you and go assess your risk. So if you see, say, you get mama or sister or person within your family where they don't get breast cancer, it go say, so it better you for not for take them. So we get certain criteria where we follow. And if the woman get high risk, then yes, we go tell and say, oh, no choose that day. Other one way no get the hormone, it better for you for reduce the risk. And maybe Dr. Bell go agree with me with that day.
Yeah, I definitely agree with you on that day. Because we have to always check the woman them or Germany back as well, and so they do the actually when in family history, and if you find out say somebody in the family gets cancer, then go advise and say whether they take another type of contraceptive, not only cancer, you get also things like thrombosis and emboli, and then she will tell the woman, so no, you advise to take other contraceptive.
Okay, thank you very much, Dr. Bell. Yes, and I've seen you. I will come to you in a bit. And by the way, Dr. Sesay, somebody don't pay a nice compliment to your accent. They say your accent posh.
Sorry.
Okay. Basically, the question we ask is, say, if man them get duct, not them breast, even though they know they breastfeed.
Mm-hmm. Yeah. Because but cool people don't know this, but we all they start as woman. Now that make woman get the power. So we all they start up as woman. Yeah. We all they start up as woman. So we guess the man then getting them where people are the woman is just because the man they produce the hormone where the woman they produce. Now that make they grow like the woman them. But yes, they get just small amounts of breast tissue inside them will be the man them. All man they get small amount. Now that make they also get risk. But like I've been on saying at the lecture, not only 1%, but it doesn't mean it could be any of us. So it's better to be safe than sorry.
Okay. I'll begin check, but maybe because I mean, if it's not the gym, will be the gym, maybe me check with the bulky. Tell me first bikini, maybe they decide for the sock many put on telly. That was weird. Anyways, I go first and then I'll count to other and then say we'll get to. Yes, and
I'd like to say something to Dr. Aziza. Quite a few years ago, I had a mammogram and they said they'd found something. So I had to go to Wythenshawe to the Nightingale Centre to have another test. And once I'd had that test, they said they had found something, but it was nothing to worry about. But it is worrying. And there is a lot of people out there that are frightened, because obviously cancer is a frightening word. I mean, obviously I was frightened because obviously they'd found something, but we didn't know what it was. And that. So I still go every 3 years for my mammogram. I keep it up and it always comes back clear, which is really good. You know, but it is frightening.
Yeah.
It is frightening, Dr. Sesay, but thank you very much for that. It was a brilliant, explained everything.
Oh, thank you. Thank you. You're right. Thank you. Thank you so much for sharing your story as well. It can be really scary. And usually, like I said, if they find that, do you mind if I speak in KRIO? I'll try.
And they understand you.
If they say if they find something, it don't mean say you get cancer, you know, that now that make then they do other tests and for check for make absolutely sure say not to cancer. And if they don't put you back to the routine screening, which is every 3 years, then they're good. If every 3 years it clear, then in a very reassuring thing. But please don't forget to do your examination as well.
Thank you so much.
Thank you very much. Another thing I can go to Aziza. Aziza, sorry, prime me this. I'll give you maybe a couple minutes for the plan and I go on to ask you a question as well. Let you touch on the psychological, you know, the mental effect of Bẹtteh and how families them as well keep will help people and where they go through, you know, we don't actually get them where they go through anything in the, and also we don't deal with that medical mental health psychology stuff where person cannot get sickness, you know, how therefore our family be able to support them. But are conscious if some people in our house as well, we not been doing necessarily. So if you're able to touch on that would be good. So the question I want to ask, somebody me asked before, is say for Aziza expand on dense breast mammogram results even after 3D testing.
What? Sorry, I'm so sorry. Maybe I
dense breast mammogram results. I think they do the mammogram, the results show that they get dense breast, and even you know that happen even after a 3D testing. So it wants to let you elaborate on that, you know, when it can happen and why it can happen, I think.
Okay. So my understanding, when then they do the mammogram, yes, different people then get, like I don't say different women then get, some women then get dense breast, so bigger breast tissue, other women then get more fat than Bobby. And mammogram is sometimes the ask for see when the breast is dense. This is a little outside my expertise because I sure say if then do the test and then do the repeat 3D test and they say and they check all things and don't see nothing, they just see the Bobby dense. It just means that you get a lot of breast tissue and they don't see anything where they worry them. Sometimes can come where they go say, okay, we go do MRI scan, but if my understanding is if they will not do all the check them and they say okay the Bobby just dense and they're not worry about anything else, then it should be okay. But I'll go pass on to my colleague them or see if they have any other ideas about it.
My other one come in, Dr. Ture, Dr. Kama, or Dr. Bẹtteh?
Yeah, I can say something about that. Yes, as Doc Bidon say, people who can get the dense breast are the young people, and people there we get bigger breasts, but mostly not the young people. And if you get the bigger breast, you dense. So through the mammography, you actually see much, but because the risk lower to younger people, they're not going to take that they make anything, especially if they don't touch. If you say don't touch, if the doctor don't feel the breast, you don't feel any lump. Then there's nothing to worry about. You know, the one the way older and get dense breasts, most of them are because they get bigger breasts. And if they see anything suspect, so something we look suspect, they can always say, okay, in Germany also, they go to do the MRI, because the MRI kind of more accurate than the mammogram, but it's more expensive, so it's like they don't have routinely. They only do the routine mammogram as well as Germany. And but if they suspect something, especially we for example, combine all together. You know, they only do the mammogram. We have to do the mammogram. We have to do examine the breast, look at the breast, feel the breast, and if you still say, okay, well, I feel something, but I know they see another mammogram, then they can do the MRI.
Okay, thank you very much, sir. Anybody else want to add anything on there before I go to the next question?
I mean, thank you so much, Doc. Aziza, that's absolutely fantastic. You know, as I say, it's a very important topic, and we all maybe know one or two people in a way, you know, involved in Gentri. I can say closer to home. Mrs. don't go through that scare day. And I tell you what, the whole family, definitely they suffer with that. And no matter whether you're a doctor or not, or whatever, believe in me, the anxiety levels, they go right up. No questions about that, because you don't know what's in and go find. But it's important for we tell with people when they know say, look, not to wait and say this now happen, that means now you get them. No, then get tested the way they get for do. And then what you do is like, you don't put the cart before the horse, you know, you don't begin go backwards now thinking, say, oh boy, now die, they can't die. No work like that, because a lot of the time, now this, we're gonna call fibromyoma, then call them fibroid, you know, like the small mouse, it's like a small lump way, containing the cyst, now what I did, you know, and it can go bigger or smaller depending on the time of the month. So push comes to shove, like how we talk about the mammograms on time, because of some people in the way well endowed, some people in the way tiny, you can see better when the breast tissue less, that's for sure. However, they're not going to just say, now this you get, then go through a few things, then look at the history, look at waiting to happen, examine you, look at the breast, whether and see if you quiz some bobby come out or not, whether the nipple don't change, you don't go inside, you know, sometimes the swelling don't there and the rest of it, you know. And they definitely scary, no questions about that. But now stage work. So something they even need for put a needle inside that swelling they you know, for see what they call fine needle aspiration, where you go get and then send and go to the lab for let them look and see whether they don't see any tissues there or not. Apart from that, if they don't get anything concrete, even with the mammogram, one thing they can finally do now for take out the lump itself. So that's not the surgical side of things. They'll take the lump, and that lump they now can't deny, because you get confirmation with that. But please, we need to understand, say, not to because they say this one a lump and a dangerous lump, and this and that not the end of it. No, as I say, a stitch in time saves 9, and that's literally waiting this thing mean. If you go and observe yourself and watch this BBC every day, if you act on them on time, I guarantee you the chances of success far more than the chances of not getting any success. So astuteness, alertness, and in-time intervention would definitely save lives, no questions about that.
Okay. Thank you very much, Doc. I think we'll get to Ba. You say further explain a little bit more about the risk and when for use, prevention, or using prevention. If you type the question a bit more so I can able understand that I will able to ask them, or if you raise your hand up, I will come to you and ask them for yourself. So please, I will come back to you. I will wait for you to type your question properly because I'm not quite understand them well. And Aziza, you get 2 screens, so I don't know which one is which. Aziza 1, Aziza 2. I see. I don't know which one for put on. I try that one day. I didn't get mic. This other one, I'm not get mic. There you go.
Yeah, because I turn it off.
Okay.
Yeah, so first of all, you say for it's on the psychological side of breast cancer and the news. Unfortunately for me, I begat a lump on the left breast. Yeah, this was like a few years back. And the whole family, literally including me, everybody with a cry. My mom was worried, my older sister was worried, my son, I couldn't tell him. I can't face to tell him. As you know, he's the only one. Then my niece, I didn't even tell her until like the day we have to literally go do the test. So the impact on the mommy was like, let them pull me on, but we put some in, let them get the had cancer, this, that. My sister, even though she's in the medical field, everybody was worried because the anxiety alone, to you, the individual, will be say, don't find this lump, is just unbearable. I was very anxious, even like the GP, I even ended up forget canceling before I even go for the test because I was scared that I was not going. So yes, later on, I took the bold step, go for the mammogram, and this now Winfield Hospital. Then do the mammogram, and then do it first, they come inconclusive, they couldn't find anything, so I get for do it again. As she said, for a younger person, squeezing your breast between that mammogram is very discomfort, it's very uncomfortable, but you get for do them. So they did it 3 times before finally they did the biopsy, where come up for say it was benign. So I was like, I'm not a diet. So that was like a massive, big relief to the family because I was literally worried. I said, why am I going to die in my late 30s? Because I was 30s then when this happened. So it really, really good for make with they really check yourself all the time. And if anybody happen say they find lump, maybe they'll just conclude saying a cancer. Get the bold step, go see your GP, talk about them, make them go do all the tests there so. And find somebody where you definitely know so you go rely on for talk to, where go able for talk to you and counsel you through it. Because nothing were not very easy. Because definitely they go become very anxious, they become very stressed, your stress level they go up, you go left for eat, you go left for sleep, it they make you so uncomfortable. So if any of them things that's what they happen to anybody, let we not take a light. Let we talk to a GP, let we talk to a loved one them, even nurses around. If you have anybody in a nurse, where you know say, this person also go able to direct me waiting for do, or even the doctors there, or like go within a so let we take the information they are so very, very important and work with them. So my question to you, Dr. Sesay, is like whether they don't go to that mammogram, they don't show say na benign. You feel say for worry say it will repeat itself, or you think say it not go ever occur again?
Hi, thank you so much for sharing. That's the scary story. It must have been so difficult for you, and I bet reliving it.
Yeah.
But thank God, not a cancer. So the question what you ask, it's a good question, and the honest truth is, I don't know. What in they confirm say they did the biopsy now the area.
Yeah, they did the biopsy. They literally went through it within.
Yes.
Took some cells out and then did the
Yes.
test and went back another week for the result.
Yes, yes, yeah. So that means the area where they've been concerned about, they don't check for see whose type tissue you get, whose kind of tissue you get, and they confirm saying a benign tissue. So
Yeah.
then it's a reassuring thing. And it don't mean say then they go change for become harmful. Like it doesn't guarantee it's gonna change. I go say your risk will be the same for any woman, where get the same risk factors as you. If for instance, get person where they inside your family, get family member that get cancer, then your risk will be the same, similar sort of risk. We don't talk about all the different things that increases the risk. So if you smoke, if you did drink too much alcohol, if if you're overweight, if you know the exercise, if you get dense body, then kind of thing that increase your risk. But just because they find benign, harmless, they don't confirm it harmless, not a cancer, means say, oh, then they go change, you go definitely be cancer. So I just want to reassure you in that regard. But it also means that you still have to be very vigilant and you get for examine yourself as regularly as you can, just in case. Yeah.
Okay, thank you.
Thank you very much. The point we Aziza touch on, basically, somebody, if you notice, say somebody will be outgoing, somebody wanna be chill, they talk nice and fine. You find out, say, you just get withdrawn. We don't deal with sessions in the past where the advice is low to have to give the person support. It not necessarily means you get for no waiting to them. So Monday you're not gonna be comfortable because even when I try to find a way for deal with maybe waiting to go on with them. So you don't mean the person get for really tell you, but if the person confide in you, one, try to keep them secret. Or two, If you see somebody not behave in normal self, try for give the best support you can. Not a way don't die, you try for, we'll go make bigger, we'll join whatever. That person don't die. But while the person they are alive, not for try for sure that love and care to one another. Okay, let's see if we have any more questions on the pipeline. Let's see. No. Okay. I'm trying to say everybody happy with what you don't go through so far. Anybody else get any more questions before we shut down for today?
I want to mention something.
Yes, sir.
Very important as well. I want to thank Dr. Sesay for this wonderful talk. And you therefore understand, say it's very important to make woman and man they know this thing here. So the one thing we people can always feel the same when they get pain. Nothing they will think about cancer. Cancer, if you get cancer, you don't get pain at all. You know, they can call it silent killer sometimes because when it starts, they actually start with pain. So that make if you feel something and you feel say, okay, well, they ask me, I know go to doctor. No, please still go to doctor. It's very, very important because most times, they actually feel pain at the start. So that's one thing I want to say. The second thing I want to say concerning treatment. Dr. Sesay mentioned, say we get chemotherapy and something and there some patients can get for take chemotherapy, something and they get for take chemotherapy. But if you get for take that chemotherapy, the doctor supposed to talk to you about fertility, especially if you're young. If you're under 35 or sometimes also okay, patients and sometimes under 40, but definitely under 35, the doctor supposed to talk to you about fertility. If the doctor not talk to you about fertility, then ask them. Yeah, because it's supposed to be a routine question. So maybe the doctor asks you, say, you want picking later on, because they get something, then if you get chemotherapy, it could destroy your ovaries for make not get egg again. So woman and born with a certain amount of egg. We've been talking about that 2 weeks ago. Woman and born with a certain amount of egg, and chemotherapy can destroy them. Not all, some. So now if you plan for get picking later on, there are some things that they can do. They can actually stimulate you and take your eggs and store your eggs. They can store your eggs, or they can take parts of your ovary and store them. Unfortunately, that is not this alone. But I know say the Ghana, I know say the Nigeria, and definitely in Europe. Yeah. So that means you get some doctors then, we know they ask young patients about that. So it's very, very important if the doctor not ask you about that and you're a young person, maybe Dr. Sesay don't talk to Black people and you can get at a younger age, please ask the doctor. Ask the doctor about the possibility for freeze your eggs or for freeze your ovaries.
Okay, thank you very much, Dr. Bell. Mr. Kamo, Mr. Dabo. Mr. Dabo? Mr. Dabo? Okay, well, I think Mr. Dabo, if you say you get a question of what I ask you for today. Yeah, the try for unmute you. I don't press on so you unmute yourself.
Okay.
There you go.
Can you hear me now?
Yes, perfect, sir.
Yeah. Okay. Thanks a lot, Dr. Sesay. I really enjoyed this presentation this afternoon, and it teach me a lot because me get quite a few female relatives and we don't suffer from this, and so don't even die from them when I'm out in Africa. But this not a woman no more now, like I say. This what is scare me the most now. The side we talk whether they talk say man can get her. Now, we picking them, they go then gym them, whether they grow boku tissues at them breast side, like them, but what then 6-pack, then so me but like quacking look at something and they that in chest side, that in Bobby that side. But look, my friend here, I say they grow Bobby. This Bobby are not big thing, so. But I think it looks solid small. Is that something to have to worry about for say get more tissue there or something? Not to play with you, but what
thank you. Thank you very much.
No, it's getting quite big. It's quite, they're going to keep almost everything. So I can't tell I want to say, let me be very careful because the more tissue you grow under, the more danger it feels in the future.
At one point, that's only where we go. Even Uncle Anyway, I will let the doctors let the answer. Dr. Sesay, then I'll come to Dr. Bell. Dr. Sesay, what do you think?
Thank you. Thank you. Good question. So what did I get for explain? So we get muscle where we call with pecs. I'll just say pecs to make it easier. So the muscle within at the chest, where they are overlying the chest now with pecs. And now then it builds. Now in pecs it builds. When we talk about breast cancer, now the breast tissue, where now I don't tell you, say man them, they get small amount just behind the nipple. So now then they would afraid. So if then they take it, then they get big, now then they would afraid. So if then they take there are certain medications where people can take where they increase the size of the tissue. Then they make that's when we go get worried. But the no jealous you picking. It looks like saying
I bet you work is very flexing one more shake the right?
No, it should be okay. But Dr. Bell, you're not a specialist in this area.
No, you don't see them. You don't see them. There are two different things. You have the muscles and you have the breast tissues, and the one with the man they build up now in my muscles, and that not get for doing it, increasing risk forget breast cancer. It might increasing risk because muscles they change to fat tissues after a while, especially when they get older. So you find like if I say we're older now, they reach about 50, the muscle now sound like it was about not like muscle again, but that is different, to breast tissue. So get a higher risk for breast cancer.
Yeah. One thing I can add to that, I know there's something like that Nain, Dr. Ture will add to. Obviously the muscle way Dr. Sesay and Dr. Bell then talk about, we then call the pecs. If you put your hand on your chest, you go feel them, and then get two, then get the pectoralis major and pectoralis minor. Then to then they grow. If you anybody cheap handles, I know if you ever hear about them, then people in the way they go and show, six packs and things like that. One thing where you need for take into consideration is that, like how Dr. Bell talked about, as you grow older, we're not in the gym again, this muscle now they turn fat. That can cause some embarrassment for some people. But if you're younger, some medicine then they, some particular tablet then they, if you take, and the people already take medicine for epilepsy, then they can cause that thing they for grow, then call them gynecomastia. The reason why they call them that because gyne na woman, mastia na like the Bobby like woman. You know what I mean? So then they can cause embarrassment in that thing we get stigma. Like man we go na gym or maybe go na sauna. You pull in shirt, they say, well, look, this guy get Bobby like woman. You know what I mean? That creates so much embarrassment and it can cause a lot of problems for people. But that's quite different from what they talk about the possibility of a man will get breast cancer. Evidently, if you feel you Bobby and you find out, say this Bobby not to so it been there, after we don't check them a few times, something don't grow up and more clearly you need to get assessed. It's as simple as that. That's all we say. But you don't mean say because you go to the gym, you get them pack them there, them pecs that they grow, that means you don't get them. No. If you're concerned about anything, go check your GP. But I guarantee you, you come back with the answer, say this one are just, muscle being toned. If you train the muscle, it will get bigger. And that's exactly what's in the happening under,
Thank you very much.
Helpful.
Yeah.
Dr. you get anything else for that?
No, I think Dr. Kama and Dr. Sesay Bell, they all don't answer, and the gynecomastia, I'm sure some people in the worry about. But then they take anabolic steroids them for build up the muscles, and then they not only get impact on the breast itself, it impacts even the fertility as well as a man. So the need for aware of that, they then steroids and then they take, and then one way they distinguish them from, the breast cancer is that normally the gynecomastia, sometimes they then are both breast rather than one side.
Yeah.
Although, tendencies, it can be one, but mostly can be on both sides. So, then they indifferent from within, the breast cancer and everything they talk. And then if a family not get, the genes, they already talk about P53 or BRCA gene, then, there's less risk as well, there. But just in addition to it, I don't say.
Yep, thank you very much, Dr. Ture. Dr. Bell, again, any last word for people before we close today?
The last word is well, body better past Gentri. When I get for take care of our health, when I get for make sure say when I examine yourself, Dr. Sesay don't talk wonderfully about this awareness, because that's the top of the awareness. Say when I get for check on ourself, when I sabi on about man and woman, when I sabi on about be past the doctor. So that nothing say, okay, I go every 3 years to doctor for the doctor check me. I mean nothing for check myself. No. You sabi Bobby pass the doctor, so make sure so you to check yourself. And when you feel something, not afraid, make them go check them. Because if you're afraid and really cancer, then it can be a problem for you. So when you feel something, make them go check them. Because as we all say, everybody better pass Gentri.
Thank you very much, sir. Mrs. Goba, any last word?
Well, just like Dr. Bell don't say, well, Bodi definitely better pass Gentri. So every woman is up to way for check with President daily. And if you see something with suspicious now your body, make sure say you talk to somebody or you go see GP, not hide anything. The good thing is within this part of the world where it's free, where they get some for free. So make use of them. And Dr. Sesay and all the other doctors, including yourself, don't say an advice with the Guinea. We're not to make diagnosis or anything. So do you not go say so Dr. Sesay say, so Dr. Bell, so Dr. Toure say, or Dr. Kamara. Every time they say an advice with the gay. So now for soon at GP, they made them go at the correct information and correct advice where you need. We just hit on most of the things that want to say they happen to people them. So not taken very serious. Once again, well, Bodi better pass Gentri.
Thank you very much. Dr. Oh, good luck.
Yeah, all right, sorry.
Let
you. No, that's Lipo. It's
you let me check. Let me check.
Right, okay, that's the problem. This is absolutely a superb session. I'm glad you say we all don't learn 1 or 2 things from Gentri. We're thankful to the presenter, Dr. Sesay. You don't do a fantastic job, and we hope so we'll continue that. But for go further, we want people for sell we, the need for promote this thing for we. That's the important thing. So would I get any connection or would I get any kind, possible way that no way will actually make this thing, be popular. Let at least, the country benefit from it with people and where they far away, make them know about this thing. If not radio or not TV or whatever, make they actually, point them to we and let we see what you will go for do, because it's important not to just for we. We all get the treatment and things, but people away the free tongues alone, no nothing but that. So it's fine for low, they point them to them to we then go for do. Who knows? You never know. But as I say, if you know about your body, you know full well say, well, Bodi, you don't get no price where you put panel. And I make it better past Gentri. Believe you me, because if you get well Bodi, you go for walk and get Gentri. Other than that, if you sick, all your wealth, all your copper we get go dump by you and the sick will take you off. But if na sick way you able for maintain, able for control, able for even men, it better let you catch them early. Now make it important. If you see anything, please, and pretty please, go see your GP. Then go definitely do something for you, and you never know, that will just be the best decision you make in your life. So thank you now all for na come one naya, and we hope soon I go sell the word. But remember, no suffer in silence, and well Bodi, he better pass Gentri anytime. Thank you.
Thank you very much, sir. Dr. Aziza, final word from you, please.
I think they said it all. Honestly, just please continue for check yourself, continue for attend these talks then, because again, it's free. And it could save your life or someone that you know, someone that you care about's life, just from learning the knowledge, because knowledge is power as well. So thank you so much, everyone. Thank you. I don't get inspired.
Thank you very much, Bifambulem. We don't come to the end of the show. I'm like, we want from the doctors, then they don't land. They don't keep part of the world. Some of them didn't on the land and can continue. Some of them don't land different parts of the world. They don't go through the whole journey. Then they give this for the benefit of we all. More than me, I don't learn a lot, from being in a company no more. Checking yourself now, the basic thing and the way you can do it, it cost you anything. But also, when we don't reach a certain age, for we Black people, the way they are about that, I think they may say 35, 40, around that age, then we get into the habit for the go see doctor for general health check. You will look and see, 500,000 about come on, 800,000, I don't know how much the price be. But think about it. If you don't catch that sickness quick, man, the way you die, one thing we mortal man we're very good at, when you die, boku. That are the realities of life. So dear, that's more money we get. It better you look and say, I go get doctor. No, not look at that way. They look and say, now your health, now you invest in. So your advice. There's a lot of things in the way we don't know, say we get mass alone. I know what I talk about. Some of we say no, we don't be around people and we don't suffer. For something way, if they may find them a couple of years before, they like together before they with we. But because of the we don't catch them, early enough, now they're not there with we. These are good people. So who are they? They will value the Bɔdi, Betteh Gentri. On a good night. Just for information as well, we not get for day again till the new year. We say, we want to spend time with the family. We get there, chicken them. I need to chicken this year and I live chicken now. But we will see that again in January. Okay. We'll all have a Merry Christmas, Happy festivities, and Happy New Year. We will see you again in January. Good night.
Thank you, everyone.
Thank you so much.
Thank you.
Bye.
Thank you.
Yeah, no, me.